According to the Centers for Disease Control, CDC, antimicrobial resistance is the leading threat to world health. As a result, antibiotic stewardship has emerged as an important initiative to combat this growing threat. Occupational therapy practitioners have a role in antibiotic stewardship. Antibiotic stewardship refers to coordinated efforts to optimize the benefits of antibiotic use to improve patient outcomes while limiting antimicrobial resistance. Antibiotic stewardship has become an urgent global priority, with the rise of resistant infections posing a significant threat to public health. Healthcare providers across various disciplines are tasked with implementing strategies to ensure judicious antibiotic prescribing and mitigate the risks of antibiotic overuse and misuse. Occupational therapists are not traditionally associated with antibiotic stewardship. However, the principles and practices of occupational therapy can complement and enhance stewardship efforts in several ways, including patient education and medication management, functional assessments, hygiene and safety precautions, interprofessional collaboration. Within the realm of antibiotic stewardship, occupational therapists have the power to educate patients about the appropriate use of antibiotics, the importance of adherence to prescribed regimens, and the potential consequences of antibiotic resistance. By empowering patients with knowledge and fostering their autonomy, occupational therapists can significantly reduce unnecessary antibiotic prescriptions and promote responsible antibiotic use, instilling hope for a future with less antimicrobial resistance. The CDC's 5 fundamental concepts of antimicrobial stewardship are: 1. Antibiotics only work against bacterial infections. 2. Differentiation between viral versus bacterial infection. 3. Proper use of antibiotics. 4. Non-pharmacologic measures to combat infection. 5. Antibiotic resistance is a consequence of inappropriate antibiotic use. Occupational therapists comprehensively assess patients' functional abilities and limitations. In infectious diseases, such as urinary tract infections or respiratory infections, occupational therapists can determine how these conditions impact patients' ability to engage in daily activities and routines. By identifying specific functional goals for recovery and rehabilitation, occupational therapists can collaborate with healthcare teams to tailor antibiotic treatment plans that align with patients' overall rehabilitation goals. Occupational therapists are also able to assess a patient's cognition. A patient's cognition will determine their ability to comply with their antibiotic regimen. Occupational therapists can make recommendations such as use of a timer for remembering medication times, use of a pill box to store the correct dosage of medicine, use of a caregiver support as needed. By optimizing hygiene practices, facilitating hand washing, and reducing exposure to pathogens, occupational therapy practitioners can support antibiotic stewardship efforts by minimizing the transmission of antibiotic-resistant bacteria. Effective antibiotic stewardship requires collaboration and communication across healthcare disciplines. Occupational therapy offers tools that can complement and enhance the antibiotic stewardship efforts of other entities. By actively participating in interdisciplinary rounds, case conferences, and care planning meetings, occupational therapists can contribute valuable insights regarding patients' functional status, goals, and progress. This facilitates more informed antibiotic prescribing decisions. Occupational therapists can also work closely with other healthcare providers to develop and implement antibiotic stewardship protocols within healthcare facilities. Occupational therapists can play a vital role in promoting responsible antibiotic use and improving patient outcomes by focusing on patient education, functional assessment, environmental modifications, psychosocial support, and collaborative care. Occupational therapists can contribute significantly to the judicious use of antibiotics and the mitigation of antimicrobial resistance. By integrating principles of antibiotic stewardship into their practice, occupational therapists can empower patients, enhance interdisciplinary care, and ultimately contribute to the preservation of effective antimicrobial treatments. Moreover, ongoing education and collaboration are paramount for occupational therapists to remain informed and effective stewards in the fight against antimicrobial resistance. With dedication and interdisciplinary cooperation, occupational therapists can continue to make meaningful contributions to antibiotic stewardship efforts, ensuring better outcomes for patients and global health security.